So I really fell in love with gerontology because I had the opportunity to have amazing relationships with my own grandparents. I grew up in rural North Dakota and on a third generation family farm, surrounded by amazing grandparents. And it wasn't only my own grandparents, but it was also older adults within the community. I had the unique opportunity as a high schooler to work as a certified nursing assistant in a skilled nursing facility. And this opportunity allowed me to do my extracurricular activities, be a high schooler, play sports, but also earn some money, and never would have thought that it would impact me as it has with my own passion in working with older adults. So working in a large skilled nursing facility, being able to hear stories of older adults, being able to see some of the challenges that they faced, as well as rural healthcare and some of the challenges with, who's taking care of older adults as they age, dealing with loneliness, social isolation, of course, mental health challenges throughout life, and really being able to see through the eyes of an older adult, as well as seeing really how much of a lack of resource and support there was for working with those who were impacted by dementia, such as Alzheimer's disease, any cognitive impairment, Lewy bodies, Parkinson's, and just the amount of support that families needed to care for those who were dealing with cognitive declines and cognitive illnesses. And that really sparked my desire to work in the field of gerontology. And I added social work because I wanted to really work direct practice and be able to really focus on working more in a hospice agency, and fell in love with hospice, the team approach, the interdisciplinary team to working with not only other social workers, but working with the nurses, the case managers, chaplains, having that support of the physician, having that team-centered approach, and meeting as a team to be able to discuss what the best focus will be for not only the patient, but the families as well. And that whole idea of teamwork and bringing in different experts from their own fields to really be able to provide the best support in somebody's end of life was such an amazing experience. And I added social work solely to be able to work in hospice, and then added palliative care onto that. Again, really understanding the needs and the supports that is needed throughout a diagnosis, and how we can better work together as health professionals. And from that, ended up in private practice where I am today, really because of a global pandemic that pushed the needle a little bit in my own family for me to be at home more versus out and about going to patients' homes. So the ability to be able to do telehealth and have a schedule that really